Good evening, and welcome to tonight's webinar, Therapy 101, Why We Go to Therapy and What to Expect. My name is Elizabeth Errico, and I am the Executive Director of the Children's Mental Health Resource Center. For those of you who are new to us, our mission is to provide guidance and resources for early identification and management of mood disorders, bipolar disorder, and its newly identified phenotype dubbed fear of harm. With me tonight is my colleague, Jennifer Sevick. She is CMHRC's clinical director. And we and the rest of our group of dedicated staff, board members, and volunteers work together to fulfill our mission by sharing the following resources with our community. We have classes in palliative parenting, which is a parenting style and approach that was developed by CMHRC mental health professionals in conjunction with parents of children who have mental illnesses and mental health conditions, as well as adults who survive and thrive living with mental health disorders. We also have a custom made for us web-based app that is for tracking symptoms, medications, and moods. We have our monthly book club, professional discussion groups, high-touch, high-expert services such as diagnostic consultation, school support, and provider transition support. And we do many other things. You can check out all of our programs and free resources on our website, cmhrc.org. But for now, I would like to have Jennifer join me in this very important conversation about therapy, why we go, what it's for, what to expect, how to connect with a provider. And we are presenting this because we get lots and lots of questions from the families that we work with about how do we get a therapist engaged with our child? How do we get that piece of the puzzle in place? And so tonight we're going to answer some of those commonly asked questions. If you have questions during the course of the event, please add your questions and comments to the Q&A or to the chat box, and we will incorporate them as we go. Any questions that aren't answered, we will do a live Q&A at the end. So Jennifer, welcome. Thank you for being here with us tonight. And I'm going to quickly review what we're going to be talking about. We are going to define what psychotherapy is, why it's important for the management of mental health disorders. We're going to explore different ways to find care and to determine whether or not a particular therapist is the right fit for your family. And we're going to provide some additional resources because sometimes, even though you know you need the help, we know that families can feel overwhelmed by this process. And before we start talking about this, Jen, I really want to spend a couple of minutes focusing on the difference between mental health and mental illness, because we're really talking tonight about the process of finding a therapist when you or your child lives with a mental illness, which isn't really the same thing as mental health in general. So why don't you just get us started with this?
Yeah, so in a nutshell, all of us have mental health, every single one of us, but not all of us live with mental illness. So there is a difference. And so mental health is about how our condition is in regards to the things that are happening physiologically to us and also our emotional well-being overall. And those can be also influenced highly by external factors that are going on, situational things, versus mental illness is an actual health condition that is chronic, it is serious, it involves a lot of care and management from day to day, and it can impact us not just in the short term, but also in the long run.
Yeah, I love this framing of like everyone has mental health, but not everyone has mental illness. And I think of it in terms of, comparisons that, you know, we've all perhaps overexerted during exercise and been short of breath, which is sort of a normal everyday thing for a human being to experience. But not everyone has asthma, which is a chronic condition around breathing. Um, Similarly, some of us may feel as though we overindulge at Thanksgiving and eat too many pieces of pie, and we don't feel so well afterwards, which is a normal human experience, which is not the same thing as having diabetes, which is a chronic but manageable condition that can often be addressed through diet if you have type 2 diabetes. So I always think of it as though mental health are the sort of normal ups and downs that we experience, all of us, just as human beings who are alive. But the mental illness is, as you said, it's a medical condition that needs to be managed long term, so that it's not the same thing as mental health, but it's not something that we need to be frightened of. It's just something that needs to be managed.
Yep, absolutely.
So, to get us started in thinking about therapy and its purposes around mental illness and its treatments, we're going to start by talking about the difference between counseling and therapy, which can be confusing for some people because they're very often, these terms are used interchangeably. But there is a difference. Jen?
Yeah, so counseling is very time limited. And it's focused primarily on one or two concerns that you may have going on, and that you understand this is what I'm here for. And it is really looking at what were your previous attempts to resolve the situation, what worked, what didn't work. Um, and we have very concrete goals to define the change that you want to have the person who is seeking services. And with counseling, the counselor or the therapist who is providing that service, they're not really, because it's so time limited, they're not really focused on getting to the root cause of the issue. They're really looking at how how can I assist you in developing some skills or a plan to resolve this as quickly as possible and as comfortably as possible for you. And that could take maybe one session, two sessions, a series of sessions, but it is very time limited. And so you know that you're not going to be in services for 6 months or a year or longer, and you have what we call planned termination. So once you've accomplished those goals and those changes have been implemented and you feel that you are satisfied and things are going well for you, then you terminate services. And of course, therapists will tell you you're welcome to come back in the future if anything changes at all. But the key is there is that there's a very specific issue and that it's time limited.
And diagnostically speaking, I think that this is a great service when folks have something that we call an adjustment disorder, right? Which really means that there's something going on in your life that is causing you trouble, that you're having difficulty managing. And it may be going through a divorce, it may be changing jobs, it may be something that's happening around you that you do or don't have any control over, and that you can go into counseling and you can say, I need to work on figuring out this particular problem. I need help finding a solution to this issue. And you really are, as you said, going to stay focused on that throughout the process and not worry about causes, not worry about digging back a dozen years throughout your life to determine patterns. You're really going to be looking at this thing that I came in with. How do I find a solution and move forward? Whereas psychotherapy process is on the other hand, a long-term commitment. And it's really focused not on a specific problem per se, but overall sort of developing that sense of insight, of being able to understand oneself in relation to everything going on around you and your past, your future aspirations. It's a much bigger picture, right?
Hmm. Yeah, and of course, there's really no time limit that we have. It could be 6 months, a year, it can be 2 years, it can be more. You're developing a real in-depth relationship with this person, that is a professional one, a confidential and safe one. Um, and both the therapist and as a participant, you're both equally involved in this psychotherapeutic process using what we call evidence-based approaches. So we're using known theories, known plans in order to help you approach this in a way that we know works. So whatever that issue is, that concern that you can't come in with, we want to make sure that those things have there's scientific information, data to say, yeah, we know that these approaches work in these situations. And of course, you're really working on trust in that relationship, and that takes time. That's why it's not, 6 sessions and you're done. It usually is something so much more involved that is going to take a lot of time, a lot of vulnerability to be able to trust in that person. And so you're just building that in order to be able to accomplish the things that you want to manage. And if we think about it, Elizabeth, if we go back to mental health versus mental illness, I sometimes look at it as with counseling, we're dealing with things that impact your mental health. But when you're talking about psychotherapy, you're usually talking about there's some kind of health condition or some sort of mental illness that you're wanting assistance with and managing.
That's a great distinction. And using this idea that rather than specific solutions, psychotherapy is a journey of discovery. And the discovery is about yourself and your relationships, and why it's so important for that relationship with the psychotherapist to not only be a professional one, but to be based on trust, to be based on respect, to be based on the idea that you can have this person who is there solely for the purpose of helping you. And I think this is a really important distinction, because we can all find folks in our lives, hopefully, who are there to be supportive during times of struggle. But it's the psychotherapist's job not to solve the problem for you, not to tell you what to do, not to give you advice or teach you strategies to implement. Um, those things may have more of a role in a short-term solutions focused counseling environment, but it's the psychotherapist's job to be a guide, to bear witness, and to be supportive for you and only you during this process, where the client is the one in the driver's seat. The client is the one saying, this is what I want to explore. This is what I want to understand better about myself. And so it's not the psychotherapist's job to dictate what the client focuses their attention on, what issues they want to work on, but rather it's the psychotherapist's job to honor the journey and to be there as a supportive guide on that path. And so that's why I love this idea that it's a journey of discovery, and you and your therapist are in that together. We want to also contextualize this in the fact that therapy isn't the only kind of treatment that's used for mental illness. And in fact, therapy works best when it is part of an integrated plan. we always refer to that as the three-legged stool because it's so easy for all of us to understand this analogy that if a stool has only three legs and you take one away, the stool is just going to fall over. It's not going to be able to stay up and do its job. And treatment for a mental health disorder is much like that three-legged stool in that we can't just treat it with one thing. We can't just say, oh, well, I'm taking medication for that, so I'm fine now. It still involves some sort of insight-based discovery and exploration about oneself and how one manages. It also requires lifestyle interventions, things that we can do at home that can help support our journey through treatment and through to stability, which is a journey, not a destination. When we're talking about mental health conditions that are chronic, we're not looking to solve a problem and move past it. We're looking for ways that we can integrate into our day-to-day lives the things that are necessary to maintain stability long term on that journey of stability. And so these three pieces are really important, and we want to go through and explain what each are. So Jen, why don't you get us started?
Yeah, so one leg of the stool is, of course, the medication management or psychopharmacology. And those are the medications that are used to help manage. When we're talking about mental illness, we're talking about managing those symptoms. So the things that you experience, the things that maybe your children or child experiences, those are the things that the medication is targeted at treating those symptoms. And typically, when we're talking about mental illness, it could be one medication or it can be more than one medication. And I know people get hung up on sometimes, oh gosh, I wish my child wasn't taking three medications or two medications. And it really is about targeting those specific symptoms to reduce those so that that person can function in their family, out in school, at work, and in the community, and do the things that they enjoy. Then another leg of the stool, as we've been talking about, is psychotherapy. And so there are different types of therapists, and there is a clinical social worker. So most people may not be familiar with that social workers can also be therapists as well, licensed psychotherapists. Then there is marriage and family counselors. So we have LMFTs as what they're known as. And then we also have licensed practical counselors as well. Uh, Clinical psychologists can participate and do psychotherapeutic services. There are a lot that do testing only, like neuropsychoval or school evaluations, but certainly there are psychologists that are licensed as psychotherapists as well. And then we have psychiatrists, but they rarely do psychotherapy. They're mostly providing that medication piece that
And
is there.
And Jen, I just want to jump in and clarify this for folks. You did a good job of explaining it just now, but a lot of people get confused about the difference between a psychiatrist and a psychologist. And so a psychiatrist is really going to fall under that first leg of the medications. A psychiatrist is a medical doctor. They went to medical school, and psychiatry is their specialty, just the way a pediatrician, kids are their specialty. And so psychiatrists, while some few still do some psychotherapy, for the most part, they are your medication managers. So a psychiatrist is a medical doctor who's going to manage your medication, and you'll see regularly in order to get your medications refilled or adjusted. Whereas the psychotherapy would be where the psychologist would fall. Again, as Jen said, a lot of them do neuropsychological evaluations, do educational testing, and that sort. Some do ongoing therapy, but for the most part nowadays, the ongoing long-term psychotherapy that's going to be done is usually done with an LMFT, a licensed professional counselor, or a clinical social worker. And so it almost doesn't matter, and we'll get to this in a little while, but it almost doesn't matter which specialty you're choosing there in terms of your psychotherapist. What matters is your ability to form a trusting, respectful relationship with them in which the work of therapy can be done. But Jen, I'll let you get back to it. Thanks for letting me add that in there.
Yeah, I appreciate that. And of course, our last leg of the stool, last but not least, is lifestyle interventions. And those are the things that are not medication related. Those are the things that we do outside of the therapist's office. Those are the changes that we make from day to day. They could be diet, they could be exercise. Those are the two most common ones that people kind of refer to. Our sleep hygiene or sleep wake cycles, people pay attention to. But there's more stuff than just those three. And so we also have in our community, we talk about at the Children's Mental Health Resource Center, we talk about cooling strategies for a very specific phenotype to bipolar disorder. We also talk about light therapies when it comes to mood disorders, blue light blockers. There's so many things that we can do that help improve our quality of life, that are really simple, sometimes not so simple changes to institute, but those are the things that become habit, they become a way of life, and they improve our quality of life overall.
So now talking about um, therapy as one of those legs of the three-legged stool, we're clarifying here and making a distinction between therapy for parents with kids who have mental illnesses versus the children themselves versus family therapy. So we're going to start by talking about some of the reasons why parents of kids who have mental health conditions might want to go to therapy for themselves. And this is really important. We've heard over the years, sometimes parents will say, well, why do I need to go to therapy? I'm not the one who has the problem. But it's extremely important for parents to have their own support. Jen, why don't you take us through some of these reasons to go?
Yeah, so we don't all have this in-depth understanding of whatever illness it is that your child is living with. And so if your child is living with schizoaffective disorder, bipolar disorder, major depression, or a specific type of anxiety or post-traumatic stress disorder, OCD, I could go on and on. But the reality is that we need a little help in resources and understanding about this illness in depth. And so that's what we call psychoeducation. And that is learning about that specific illness. And I will say, or illnesses, because sometimes when you live with one disorder, it is not that uncommon that you also live with another co-occurring disorder. And so it can be quite complex. And having another person step in and be able to say, okay, these things that you're witnessing that you might get frustrated with, these are symptoms. These are not behaviors. These are symptoms of the actual disorder. And so I want to put that into context for you. And that helps that parent understand. And then when they understand, oh, wait, I'm seeing a symptom here, then they can start to put together treatment strategies. How do you target those specific symptoms? You know, how do you parent a child who's displaying those specific symptoms? How do you meet their needs? Finding out from the therapist resources available. And so those are people that are going to know what's available in your community or what may be available to you, but it's outside of your community that you haven't ever even thought about. And the other part of that is parents grow and they learn through this process. They become what we call at CMHRC parent professionals. And so they're able to partner with medical providers and people who are providing services for treatment, for educators. They're able to help other families understand, but they're able to really make informed choices regarding the treatment. And they really become a partner in this process. And so that really helps when parents are trying to decide, well, what treatment approaches am I comfortable implementing in our home at this time? Being able to ask questions about medication and side effects and saying, I was doing some reading and this, can you answer some of these questions for me? It helps parents to become more comfortable speaking up and advocating for their child in this process so that they can help make suggestions for necessary accommodations and modifications in whatever environment that their child is in, whether it's an extracurricular activity or community activity or in their school education plan. So those are just some of the benefits that parents have when they're participating in therapy for themselves.
And I really want to underscore what we've talked about around the having a non-judgmental professional there to validate and acknowledge your experience. A lot of parents that we see and we work with come to us having a lot of feelings of grief, a lot of feelings of guilt, a lot of feelings of shame, a lot of feelings as though they've been told, sometimes by other professionals or by their school or by their family and friends, that their child's troubles exist because of the way that they parent. And so being able to speak with someone whose sole responsibility is to help you process those feelings and move past them, to recognize the faulty logic that led people to suggest that it was parenting that was the problem instead of the mood disorder, for example, is extremely validating and empowering for parents to be able to have someone who has seen this before say, this isn't your fault, and there are ways that we can help you manage it.
Yeah, I mean, we see that when we're able to understand the symptoms, then we're able to separate our child from their illness because our children are not the illness. They're their own unique, wonderful person. But sometimes when things are tough, it's really hard to separate those. And so we can learn to be effective parents and we can learn effective ways to approach our child and to assist them and help them to regulate. And we can parent differently and get that courage and that strength to be able to, and that confidence to be able to say, you know what, I can parent differently because my child, they have different needs. And that is absolutely okay to make very different choices than maybe what I grew up with as a kid and now a parent, or what my siblings are doing, or neighbors are doing, or friends are doing. Or even I can parent differently this child from their sibling, which is kind of radical for a lot of families.
It absolutely is, and you say that children are more than their illness, which is part of what one of the benefits of therapy for the kids is, and their reasons to go is to explore and see themselves in a better, more realistic light. They're able to learn that they are more than just their illness, and this is so important for kids because very often, we all know the sad statistic that from the time symptoms start to emerge until an accurate diagnosis and effective treatment plan are in place, the average time that takes for a family is 10 years. And so kids have often spent 10 years at doctor's appointments, testing appointments, sitting in the principal's office, and in a sense being told that they're a bad kid, or being told that their whole identity is this illness that they live with. And so having a place where they can explore the feelings that go along with that and have a professional there to help them reframe that self-perception is an extremely important process in being able to accept that one has the illness, but that it does not have to define them as they live their lives. Jen, you want to talk about some of the other reasons we have here for therapy
Well,
for kids to go?
yeah, absolutely. And kids can, understand themselves. They can understand their symptoms. As you pointed out, they've lived years with what feels like blame and shame, and even a sense of hopelessness that things aren't really going to change. I actually hear and read a lot where I see in documentation, you could do this if you wanted to. And we have to keep in mind that these are not willful choices or willful behaviors. This is not manipulation or attention seeking. These are symptoms of an illness where they do not have a choice here. And so kids can gain insight about their illness and to separate it from that. And they can look at that from an angle where the therapist can offer unconditional positive regard. And so that is like key for parents to understand what that means. So that's a big phrase, unconditional positive regard. And that just means that there's nothing that your child is going to say that is going to be rejected or turn that therapist off. They're going to be liked regardless of what symptoms that they display. Maybe they might hear about how that child went home and even seen pictures of the absolute destruction and chaos or holes in the wall. And that therapist is going to be like, you know what? You're a good kid and I like you. It's really seriously understanding them. And again, we talked about before that building trust over time. Um, and so being
Jen,
able to see
I just want
themselves
to
in a
jump in and give a context around that term, unconditional positive regard, which actually came from Carl Rogers, the psychological theorist who developed person-centered therapy. And this idea of unconditional positive regard comes from him, and the idea that we don't have to approve of each individual action that a person takes in order to regard them as a worthwhile human being. And very often, kids who have mental health disorders wind up being reduced to their actions and their symptoms instead of being seen holistically. And so the therapist might say, you know what? Yeah, it wasn't great that you trashed your living room and broke your TV, and we're not going to condone that uh, action that happened, but we're going to see you for a complete human being who has worth, who has value, and I will continue to like and appreciate and support. And that's a really key piece, I think, that sometimes gets forgotten in the goal to have change occur. That change can't occur in the therapeutic relationship until that unconditional positive regard is in place. Sorry to
yeah.
interrupt you, Jen. So you go
No,
ahead.
I love that explanation because that's why children often feel safest with their parents because they love them unconditionally, right? They know no matter what I do, you will love me. And so having another person outside that family who has that unconditional response of, I like you, regardless of the circumstances or your symptoms. I like you and I see all of you. But therapy also is a way to have insight about how to take care of yourself. For the kid to learn when they are getting symptomatic to be able to speak up and advocate for themselves. Also for self-care. We as adults need self-care, but children need self-care as well. And so to be identifying, what things nourish them, what things nourish that kid, what really feed their themselves so that they can, see themselves in a positive light. Also helping them understand social situations. and shedding light on that and to be able to break things down and break it apart. Um, Helping them see, ways that they could function at school and advocate for themselves. And of course, that doesn't happen inside a vacuum because kids don't have necessarily autonomy, but to be able to see what the advantages are of actually following through with accommodations. Sometimes schools do the accommodations and modifications and the kid just goes, "Nope, I'm going to reject those. I don't want those." And so a therapist can be like, "Oh, hold on. Let's look at why this was set up for you. Why, you might want to consider that yes, these things are beneficial and I understand you don't want to be seen as different, but here's how this benefits you in the long run." And then of course, helping them to learn the steps, especially as they get older, about how to manage their illness and those things of how to manage things like calling the pharmacy and doing script refills and all the things it takes to manage that illness. And it helps to have another person, even though parents are there too, because sometimes we don't always want mom and dad nagging us. Sometimes we need an outside person to assist that in that process so that we can enjoy more family time together. And of course, helping them to see themselves being able to be capable of things like work and school and friendships and relationships, because of course they are. And trying to really see the whole picture of why all three legs of the stool are important, why those lifestyle interventions are going to help them along with medications. And again, I know we keep stressing on this, but helping that child to see you are not your illness. You are not OCD. You are not major depression. You are not bipolar. You are not schizophrenic. You are separate from your illness. This is something you live with. This is something we can manage. This is something you can manage. And you can have a good life. And so that's really important to have that person that you trust to be able to establish. That's a lot of things to cover. And that is why psychotherapy is not time limited.
Right. It takes a long time to be able to establish the kind of rapport and the kind of relationship and the trust necessary to be able to disclose all of the stuff that has to be disclosed, to be able to be vulnerable with your therapist. And this is true for adults, adolescents, kids. It doesn't matter how old you are. Engaging in that therapeutic process, it takes time to establish the relationship, because that relationship in therapy between therapist and client is becomes a microcosm of that person's relationships and interactions with the world, and they can learn through that relationship different ways of managing in the larger world. And we always come back to the fact that this doesn't happen fast, and it really doesn't happen for kids who have struggled for a long time and not gotten the help they need. It doesn't happen quickly for them either. And so they need a lot of time. And sometimes parents will come to us and say, "I don't know that therapy is working because they've spent the last 6 months playing checkers." And we say, "No, that's a good thing. That means that that therapist is working hard to establish trust, to establish rapport, to establish the idea for your child that they are safe in that space with that person." And so that process takes a long time. And sometimes when insurance companies or agency programs are time limited, we go in and we say to those therapists, "You're not going to be able to get the kind of rapport and trust and sense of safety with this child in 3 to 4 sessions the way it's being expected. You are going to need 6 months, a year of showing up for that kid every week, so that they know that you can be trusted." Not running off to their parents or their school or their teacher the first time they say something that's a disclosure for them of how they feel about something that's going on around them. Maintaining that confidentiality when it's appropriate, so that that kid knows I can talk to you and I'm safe here. And it takes a lot longer than most people realize.
Yep, it
Now,
sure does.
there's also therapy for families. Jen?
Yeah, so there's a lot of grief and a lot of loss. Um, when our children are born, we just don't imagine that they're going to be living with such a serious health condition, especially at such a young age. But unfortunately, children do live with illnesses. And so the things that we imagined, the activities that we might want to participate in, all of those things, we do experience some grief and some pain, that living in a world where people just don't understand mental illness and sometimes just don't offer us the grace and the understanding that we need as families. And so having that place to be able to process that, and to be able to understand, um, that this, a place where we can acknowledge that these things are happening and that, we're not always welcomed in certain spaces. Um, and it helps to normalize for the entire family what they're going through. Because the symptoms, that are happening there, we can say, well, I know that this feels really bad or this seems odd, but this is what happens with this particular illness. So helping everybody to wrap their mind about around that and to get everyone on the same page and to really help, reduce or even eliminate some of that guilt and that shame of not really living up to maybe, meeting social standards or family norms that are in place, and maybe expectations at school or out in the community. So being able to process that stuff is really important. And then the family can also learn coping strategies. So yes, as we are trying to adjust medications, and that can take time to find what's appropriate for that child. We can learn some strategies together as a family to help, our loved one who is living with this. And we can learn as a family how to respond to that person when they're symptomatic. And also being able to give families permission, because sometimes families don't feel like they can try things that seem so wild. And so we can say, you know what, go for it. If you think that this is going to work and this is going to help ease, this time when it's really hard for your family, it's okay. Go for it. Use that strategy. And that family might think, oh, but this is so, nobody I know has ever done this. It's okay. Go for it. And so we know, that families need that place. And of course, um, it can be a place to help plan and prepare together as a family. And so when you live with mental illness, there are ebbs and flows to this. You're not always going to be as symptomatic or even symptomatic. But you want to plan ahead and prepare for what would this illness look like? And so that's going back to that psychoeducation piece of when it gets really, really bad, what could that look like? And planning for what if that were to happen? What are the resources that are available out there in the community? Who do I call? What steps are in place? Because when there's a crisis, that is not the time to learn. When you have an urgent or an emergency situation, um, having that plan ahead of time with that therapist knowing the resources that are available to you can be an absolute lifesaver. And that is not an understatement. In some situations, it literally can save lives. So that planning process is really helpful. And we know that it is not always ideal for that child to be participating at that time during therapy when there is an emergency situation. And so, Elizabeth, would you mind talking about a little bit about why or when is it not always ideal for the child to be participating in therapy, but it is ideal for the parents and for the siblings or extended family members?
Yeah, that's a great question. And we see this all the time. When kids are living with a mental health condition that has debilitating symptoms, when those symptoms are present, it can really be the wrong time for them to be engaged in some sort of insight-driven psychotherapeutic work. And so there are times when we are juggling these three pieces of treatment, medication and therapy and lifestyle interventions, and that therapy, the child may not be able to come into therapy that week. That child may not be able to come into therapy for a few months because maybe there's a medication adjustment that's taking place. Maybe they are experiencing a major change in life that is making them feel so raw and vulnerable that right now is not the time to be delving into root causes and solving those those underlying issues that are repeating. And so that doesn't mean that the child is unwilling. That doesn't mean the family is uncooperative. It means that at that point in time, it's not the right time for that child to be engaged in that work. But that doesn't mean the rest of the family can't. And that having a parent attend therapy sessions, having a parent, two parents, a child, a sibling, having other folks in there still provides the therapist with important information regarding the family dynamic and context in which that child is living. And so, yeah, sometimes the child isn't well enough. Sometimes they are resistant and they don't want to be a part of it. But by showing up as parents to that therapeutic process and continuing to engage, we're modeling for them how effective mental health self care works. And so not only are we modeling it, but we're giving them a safe space so that when they're ready, they can return and they can be there with us. And this feeds into this idea that the family therapy is there to validate the experience of everybody, not just the individual who has the condition or disorder, but also the siblings and the parents, to address their struggles, their traumas, their difficulties that have arisen out of living with these disorders. And it's not an isolated experience. Treating a child who has a mental health condition means treating the family. And that is important work because not only are we then validating the experiences of all family members, including those siblings who may feel as though they have been neglected, may feel as though they have not had the same opportunities or attention. They may blame their parents, but then it feeds into this process of repair work that we are able to engage in family therapy, repairing the damage that the illness has done to the relationships. And those could be the relationships between parents and children, between siblings and co-parents, and that therapeutic space is a neutral place where amends can be made, where family can discuss the things that maybe they wish they had done differently or they wish somebody else had done differently. They can learn strategies to work together while openly discussing and accepting in a respectful way that leads to forgiveness. And I think that's really important. We don't often think about the degree to which parents may need to feel as though they can forgive themselves for the mistakes that they may have made, that they can forgive their children having these disorders in the first place. Siblings can forgive not having been supported enough, for example. And so it's to relate to relationships, really feel validated that everyone is being heard, everyone's issues are being witnessed and addressed, and that no one needs to feel neglected because they are all having met in this therapeutic environment. That can really turn into some joyful exploration for families. It's not all about hard work of deep emotions. Sometimes it can be about unearthing ways that families can bond together in ways that don't have anything to do with the illness that brought them there. Jen, do you want to talk a little bit about these activities and other pieces?
Yeah. So, um, the other, I just love what you have said because when it comes to repair work, um, there's just so many things that siblings experience, right? And so they've gone through their own traumas too. And parents are worried about, well, what does this do for my other child who has had to bear witness to this illness, um, has to have seen so much, to have made so many sacrifices. And that is a time where they can work that out in that neutral space. People can make amends. And while we say we understand that these are symptoms, these are not willful choices, there still needs to be that place to be able to say and validate this is what happened, this was our experience that happened, and how do we move past that?
So our next slide is on finding a therapist. So now we understand why we're going. Now we got to find the person that we are going to be working with. And so ways to find a therapist they're actually abundant. We can simply start by asking our existing network. That can be family or friends. That can be primary care providers. That could be your occupational therapist, speech therapist, a school counselor, a teacher. Anyone who's in your network who you trust is someone that you can say, do you have a therapist that you like? Is there a therapist that you would recommend? And very often people are very happy to say, yes, I love my therapist. This person's great. You should definitely try them. Jen, there are also ways to get this from online communities.
Yeah, a lot of times with social media, especially with Facebook, parents are plugged in, they belong to groups, and there's this great button, and you can press anonymous, and you can say to a group, like a mom group, in your community, hey, I'm wondering if somebody can recommend a therapist who's really great with generalized anxiety disorder in children. You don't have to give any specifics, and just say, and accepts Blue Cross Blue Shield or accepts Cigna or Medicaid or whatever your insurance is. And you'll be surprised that many people are willing to write in who they're seeing. The great part about that is sometimes they're like, ooh, I did not have the greatest experience with this office and the billing. And so you can kind of get a lot of feedback about whether or not you want to try a different place or have like kind of an order of a priority list of who you want to look at first, of course. But there are other ways too. Psychology Today is a great resource. You can go online, type in your zip code, and what you're looking for, because there's psychiatrists and psychiatric nurse practitioners, there are providers like therapists in your area, and you can see what they specialize in, what insurances they take, and their phone number and their website, and it gives you a little information about that therapist, so you kind of feel like I might want to try this person or I want to try that person. So it's a great resource. But we also have NAMI, the National Alliance of Mental Illness. Most communities have their community NAMI that you can call up and say, hey, who can I see? And they usually do have a list of providers that are known in the area. And so that can be very helpful. You can call your insurance companies, but that's a little tricky. And the reason why is yes, they can provide you a roster, but that does not mean that it's up to date. And so you may have better luck with word of mouth, going through those other avenues, but it's still worth getting, that information from your insurance company. You just have to make sure that you call and verify that yes, they do still take your insurance there. There are lots of teaching centers, local colleges and universities that offer a free or reduced rate or on a sliding scale because they have people who have often graduated, but they are still learning that process. And so they would be happy to have you as their client and to be able to work with you. And so they also have student interns and they do have experienced people supervising them. So it is a great avenue to be able to get that. And they get such great supervision when they're at these teaching centers. So it really could be a great avenue for that. And then we have FQHCs, and those are federally qualified health centers. And so a lot of people don't know about them, but they are community health centers that are federally subsidized by the government, and they're in a lot of different communities across the US. And the reason why they're subsidized is so that they can bring quality care, medical care, including behavioral health services, to communities where they are serving people who are on Medicaid or Medicare, who are not insured or underinsured and having a hard time or has an insurance that not a lot of people take. And so those are the places that you can go see. And they usually have primary care providers. Often they'll have a psychiatric nurse practitioner and behavioral health therapist. They'll also have a dentist. So it's kind of like this one-stop place. So you can look to see online if you type in FQHC near me. You can see if there's one available in your community, or also community mental health or community health programs. Those are also subsidized as well so that you can find affordable care. And then we have the certified community behavioral health or community health, mental health is what it's often frequently called. And those are places that are, again, used to being able to serve those who are very vulnerable, who are underinsured, not insured, or who have Medicaid or Medicare.
And I also want to point out that this is not a sort of a list of either or. You can combine here. So
Mhm.
obviously we recognize it's really important to be able to afford therapy. And so oftentimes it does involve your insurance company. So you may get a list from your insurance company of providers that they connect with, and then you cross-reference that with Psychology Today and what people are saying about that provider online, or whether or not your friends or family or someone in the school has also worked with that therapist in the past. And so you can use this sort of as a web to narrow down your viable choices for who is going to be the person that you're going to work with. And one thing that we always tell people is that when you are looking for a therapist, very often therapists are overbooked, right? They have waiting lists. And we're so eager to get in to see somebody to get some help that we forget that we are interviewing that therapist to be our therapist as much as that therapist is interviewing us to be their client. And so when you're finding a therapist that's right for you, it is okay and in fact encouraged to ask questions to make sure that you are getting from this therapist what you need. And the truth is that not every therapist is well practiced and experienced in every single diagnosis. And so it is really important when you're calling around to ask questions like, are you familiar with my child's diagnosis? In the case of something like bipolar, which there is still some controversy in the field as to whether or not kids can have bipolar disorder, it is okay to start with, do you agree that my child's diagnosis can exist in the pediatric population? And really say, because you're not going to want to see somebody who's going to go in and try to convince you that your diagnosis doesn't exist. You want to go in to talk to someone who's well versed in it. And there's a whole series of questions that you can ask after you get that answer. Jen, you want to take us through some of them?
Yeah, so one of my favorite questions to ask is what kind of books would you recommend on the specific disorder? And so if that person has any knowledge or expertise in that area, they should be able to tell you if they identify as someone who routinely works with individuals who, for example, live with bipolar, they should be able to give you 3 or 4 books that are like, yes, these are really great books that parents have found very helpful. These are some websites that you might be able to go to. And again, if it's OCD or if it's major depression, any of those things, they should be able to give you some resources so that you feel confident. Okay, they're showing that this is something that they're very familiar with, of course. Um, Asking them what kind of treatment approaches or treatment modalities do they usually work with when it comes to this particular illness. And so not every treatment approach is going to necessarily be appropriate. And so that's where when parents are familiar and they've done some reading online, they kind of become acquainted with what are some of the most common treatment modalities or approaches that therapists are going to be using with these things. So those are a great lead in for discussions. And then, of course, looking at asking them things like, what other types of treatment or ways to manage this illness? So we've talked about medication, we've talked about psychotherapy, but those lifestyle interventions, what things are they familiar with that's going to help assist with, improving the quality of life for you, your child, your family? And what can I do if there's an emergency? What is the process of being able to get a hold of you, to notify you, the places in our community? Are there after hours? What does that look like? And then if they're not available, like honestly, things just happen. They might get COVID, they could get sick, just anything could happen. They might have to take some time off. So who is that backup professional? If you are unavailable for any reason whatsoever, who is going to ensure that continuity of care so that we don't lose any progress that we've made? We continue on that path, and that person can step in. So those are some things that initially, when you're going through, you may want to ask those questions to give you some degree of confidence that maybe this is a person that I would like to try. Most therapists, and not all, but most, offer a free consultation by phone. So before you ever even get in to go and see them, they'll offer you anywhere from 15 to 30 minutes. So it gives you the maybe confidence that, all right, this is worth scheduling an appointment to go in to see further if this is a good fit. Or you could just say, ooh, you know, there's some questions that just didn't really sit right with me, or I don't feel like they really understand our situation. I think I need to try the next person that's on our list.
And as Jen pointed out, it is important to ask about resources as well when you go in, because if a provider is well versed in the diagnosis that you're seeking support around, they are going to have ideas about books, about online resources, podcasts, researchers that they think are helpful to follow online or to watch videos of. And you also want to ask them if there are any national organizations or nonprofits that are going to be beneficial resources. And as Jen mentioned, yeah, what books would you recommend not only for me as a parent, but what books are age appropriate for my child to help my child understand the disorder that they've been diagnosed with? Asking about resources doesn't mean that you're expecting that your provider or your therapist is going to be able to give them all to you, but that they know what direction to point you in. And so, as I was mentioning, you know, this is a long process getting in to see and find the right therapist. And it can be a daunting task for parents to think, oh no, now there's this other thing that I have to invest all this time and energy with. But it is worth it. And one thing that I always recommend when people ask is, once you've done that legwork and you have gotten that list of providers and you've cross-referenced it and you've narrowed it down, now go and make appointments with 3 of them for those, as Jen mentioned, those possible free consultations or reduced fee first sessions, and attend all of them and ask all of your questions. Bring a list of questions. Therapists like it when they have informed clients. So you come in with those lists, ask your questions, and really listen to the answers that you get. Not only listen to what they're saying, but the attitudes about the questions that you're asking, the attitudes that is coming through in their answers, how they feel about it, and get a sense of your comfort level with them. How willing are you to share with them, be vulnerable with them, let them know private and personal things that are going to come up during the process of therapy. And at the end of that session, or of those 3 sessions, you're going to make a follow-up appointment with the person you felt the most connected to, that you felt the best with. Because different providers are going to have different demeanors, they're going to have different personalities, they are different human beings, and you're finding the one that works for you. You may want someone who has a no-nonsense attitude and is going to tell you how it is, and they're not going to mince words, or you might want someone who's going to be extremely gentle and not push you at all. And so what was right for you might not be right for your neighbor. And so one therapist might not be the fit for you, but perfect for somebody else. So it's not personal. It's about finding what works so that you can engage in this process in a way that is beneficial to you, beneficial to your child, and beneficial to your whole family. And finally, we want to share with you some additional resources. We are a resource center. We are the Children's Mental Health Resource Center. And so we have lots and lots of things. You can check out our website for listings. The menu tabs at the top show you lots and lots of different things that we offer, from really high touch services that we call Wayfinder, where we're working with families long term on issues related to school or diagnosis. But we also have things that make just your quality of life improve by being able to connect. We have these free webinars and clinical seminars. We have our monthly book club. We have a page on our website that just lists articles and podcasts and YouTube videos that are really great, supportive of parents, helpful in terms of psychoeducation and understanding. We have our own YouTube channel that has all of our educational videos available. And we also have our palliative parenting class, which I'm going to take just 2 minutes to explain that this is, as I mentioned at the very beginning, an approach that was developed by us in order to support parents in meeting the needs of their children, reframing their perspective on parenting, to do all of the empowerment, permission giving, and needs meeting that Jen has talked about throughout this entire event tonight. And so that has classes that begin every quarter. We have one getting ready to start in a few weeks. If people are interested, you can just email us at admin@cmhrc.org in order to get more information about participating in one of those. We also really want to underscore that NAMI the National Alliance on Mental Illness, the Depression and Bipolar Support Alliance, and Mental Health America are all resources that have all kinds of supportive videos, uh, documents, materials that can help families and individuals who are struggling. NAMI and Mental Health America both have local chapters in every state where you can connect with other people who are living with the same challenges that you are. This slide has some of the works that were cited during our presentation on therapy and why it is important. And if you are interested in a certificate of completion, at the end of our live event tomorrow, you will receive an email from Zoom that will have a link to request a certificate, and it has a small $5 preparation fee. And that is our presentation for this evening. So I want to thank you all for coming and for being with us. And we hope that you join us next month, when we have a new set of events planned.